These videos are made for the members and students at the Sports Therapy Organisation. Hi, I'm Tim Allardyce, physio and osteopath, and I wanted to do a bite-sized video for you on the shoulder joint. The shoulder joint is the one that causes the most problems for therapists, and it is a confusing joint. It's a complicated joint. Let's look at it. Well, here's the joint. It's a ball and socket joint, so it fits into this very shallow socket here, which we call the glenoid labrum, and or the glenoid. Sorry, the labrum is the rim of the socket. And the shoulder is a very mobile joint because the socket is so shallow, it does a lot of movement, and that's why it often gets into a lot of trouble. So here's the shoulder joint. It's capable of circumduction and flexion and extension, and it rotates inwards and outwards. So it's a very cool joint. Now you've also got a joint next to it called the acromioclavicular joint, and that's the joint between the clavicle and the acromion, which is the protuberance on the scapula. So there's the acromioclavicular joint. Now this buddy is the one that seems to cause the most problem with people. We know this can get a little bit arthritic, or it can go through a process of something called hypertrophy, which is where the joint gets bigger. That can lead to something called subacromial pain syndrome, or it used to be called impingement. I still quite like the term impingement, but essentially what happens is the supraspinatus is the tendon. This is a rotator cuff tendon, and it should sort of move quite nicely under here, but what happens is the tendon starts to get irritated and inflamed, and it can irritate a fluid sac here called a bursa, which protects the tendon, and it can cause a lot of inflammation and pain and irritation of this tendon. And this is a common problem that we see with a lot of shoulder pain patients. And there's different names, so we could call it impingement, or we can call it subacromial pain syndrome, or rotator cuff related pain. So now what we'll do is we'll do an examination of the shoulder, and we'll have a look at the shoulder. So I'm going to ask Lucy, who's a student with us on placement, if we can do an examination on her shoulder. First thing we'd probably do is to first of all go to history. So we want to know, when did the shoulder pain start? How did it start? Where's your pain? Are any things that aggravate it? Are any things that tend to make it feel better? And is there any other medical history associated? It might be family history, or it might be any medication, or any work ergonomic issue, any hobbies, lifestyles. Perhaps Lucy is a keen tennis player, and that might be aggravating things. So it's worth knowing a bit about her as a person. Once we've taken a history, we're going to ask consent. It's going to make sure it's okay for me to examine, to touch, to treat, and we're going to do an examination which will help us formulate a diagnosis, and that will give us an idea as to what we're going to do with the treatment. So Lucy, if you copy me, I'm going to examine your shoulder. So just lift the arms up to there and all the way up for me. Great. So we're checking flexion, arms back down, so arms to the sides, turn the palms up and all the way to the top. Checking abduction, arms back down. Good. Let's check for internal rotation. So just reach as far behind your back as you can. That's great. And I can often just measure that and just relax. And now with the other arm for me, please. Yeah, oh, a bit stiffer on the right hand side, aren't you? So you can see there's a clear difference. That shoulder is definitely stiffer than the left shoulder. So we've got a reduction in internal rotation of 3 or 4 inches. That's great. Let's see your external rotation. So let's check the external. That's great. Put a finger there just to measure it. Now this one, just to let that one relax. It's about the same. So interestingly, there is a bit of restriction in the internal rotation. Great. Spread your face this way. We could just check the strength on the shoulder as well. So how's that? Push against me. I'm just comparing left and right, and just pull inwards. That's great. It's just a very quick examination. As obviously we'd go into a little bit more detail. We'd do special tests and things, but I just wanted to give you a bite-sized, short summary of just a quick shoulder examination. So we might do some treatments. Let's talk about some treatments we might do. Lucy, do you want to have a lie on your back for me? So here's our shoulder joint. I might actually just use this one. It's going to be a little bit easier. And let's just mobilise the shoulder, so we can do some passive mobilisation. So we can just gently mobilise, gently loosen up the shoulder. We can mobilise into flexion. We can do some stretches, so we can do some external rotation stretches. Now, a lot of patients might be quite stiff in the shoulder, and these might be quite painful for the patients. We're not going to go too hard, and we're going to internally rotate. This is a bit stiff, isn't it? So you can really feel that, can't you? This was the stiff side. So interestingly, when you internally rotate the stretch, that should go further down. That's quite stiff. So this is a good exercise that we're going to give to Lucy later. So there's our stretch there. Does that feel quite tight? Yeah. Now we can do some massage to the shoulder as well if you want. I don't tend to do much, but you can just massage around the anterior insertion, around the bicipital groove and the pectoral insertion if you like. We can do some trapezius massage as well, just working into the trapezius. I'll show you from the other side. So you can just work into these muscles here, or work around here if you like. Good, and then the last thing we're going to do is prescribe some exercises. I identified, this is why examination is so important, I've identified that Lucy's actually got, that she didn't realise, a little bit of a stiff shoulder on the right side. So if we know that internal rotation is quite stiff, then let's do a mobilisation, an internal rotation mobilisation. So Lucy, a great way to do that is just to reach behind your back like this, and then with your left hand, just gently push the shoulder up to you push it up to your end of range, or where you feel comfortable. Don't have to push it too hard, but just push it up to your end of range and then relax. Push it up to your end of range and relax. Push it up to your end of range and relax. And you can repeat that a number of times. You can imagine the more you do that, gradually the shoulder will start creeping and getting more mobile. So it gradually gets higher and higher. So that's a really nice internal rotation stretch. We call that the bar strap stretch because you're kind of reaching for the bar strap. You can also do it with a towel as well. So you pull a towel and pull your arm up with a towel. So yeah, they're two good stretches you can do. And also we can do strengthening exercises as well, of course, stability exercises. You know, a good stability exercise just to sit down here, just put some pressure through the arms and just lean on one side. Or another good stability exercise is just pushing against a ball on the wall. I'll show you with my hands. So if you literally just stand up, and just push into me, good, and I'm just going to move up and down, and you're just going to work the small muscles around the shoulder. Great. You can use when a patient's on their own, a patient can use a ball against a wall to do the stability exercise. But these are just, you know, some very straightforward exercises. I mean, there's, you know, hundreds of good exercises that are available on Rehab My Patient. So this is just an example for you. So let's look at some exercises we can prescribe. Okay, I'm going to prescribe some exercises for Lucy. So let's create an exercise plan for her. Just add the exercise. So let's go to the shoulder, and let's just go to all. So we've got quite a lot here. These exercises are really good for acute shoulder pain. So you've got a pendulum or a passive flexion arm lift. It's really good if your shoulder's really sore. If your shoulder's not quite so sore, door frame stretch is a good stretch. But let's talk about the internal rotation exercise. We knew that internal rotation was stiff on Lucy, so let's go to internal rotation. There's the exercise. That's an active bra strap exercise. That's a passive bra strap. That's the exercise we want to prescribe. So let's give that to Lucy there. And we also talked about some stability exercises. So we talked about the sitting stability exercise. So and pushing a ball against a wall. Here's a ball against a wall exercise. So let's just add that. And there's my exercise program. I probably don't want to prescribe too many more than that. I think that's probably enough. Let's just remove that one and remove that one. And let's call my shoulder rehab. Press continue. And let's put in my sets and reps. So repeat for 1 minute and repeat that 3 times. Let's repeat 10 of those 3 times, and let's hold for 30 seconds and repeat that 3 times. Press save, email and print, and your exercise plan is done. What we did today in this bite-sized video, we just did an examination on the shoulder. We have now done some treatment, just showed you 2 or 3 treatment techniques, and then we prescribed an exercise plan for Lucy, so that Lucy can go away and do the exercises after the treatment finishes. And we'll probably also have a chat about things that might be aggravating her shoulder. So we might chat about maybe if she's a tennis player, for example, we might talk about reducing tennis or maybe resting a little bit more in between tennis sessions, or modifications, speaking to her tennis coach if that's aggravating her shoulder, or whatever it may be. You know, we just look at the lifestyle of that particular patient or client, and then we figure out what we need to address to offload it or to take the pressure off the shoulder. So that concludes my shoulder, and I'll move on to the next video for you now. Thank you. Good.